Your doctor may recommend an AC repair or arthroscopic acromioclavicular joint separation repair if the ligament in your shoulder are ruptured or torn, indicated by a bump above the shoulder. The AC joint is located where the acromion, highest point of the shoulder blade, and the clavicle, collarbone, meet. The separation in the AC joint is due to direct trauma to the tip of the shoulder. With the use of the Arthrix dog bone button, the surgeon performs the AC dog bone technique to repair the AC joint. The surgeon will begin by making an incision and inserting the AC guide through the portal. Then he drills through the clavicle and coracoid. After drilling, he removes the stylus from the cannulated drill bit, then feeds and retrieves the nitinol wire from under the coracoid. Next, he creates a loop with ultra-high-strength suture tapes and slides the dog bone button onto the suture loop, and pulls the tape through the bone tunnel to seat the dog bone button against the base of the coracoid. Then he attaches a dog bone button to the suture tape exiting the clavicle. Next, the surgeon relocates the clavicle to the correct position in line with the coracoid and ties the tape over the button, completing the repair. This procedure helps relieve pain in the shoulder and improves function to resume normal daily activities.